Okay. So yesterday we started our oil infections, and the first part was viral infections. And the viruses we included for medically important oil infections were HSV, herpes simplex, varicella zoster, Coxsackie virus type A, human papilloma virus, rubeola virus, Epstein-Barr virus, retrovirus. It does not mean that other viruses do not infect oral cavity externally or internally. Like mumps also change the extra oral, mumps also have extra oral manifestation on oral cavity. So, but we are not studying here. Same as rubella also have some intraoral manifestation, but we here are focused on the 7 important viral infections, medically important and for exam, and these are most common types of oral infections and the pathogen involved. Same as the case bacterial infections and fungal infections. But for viral infections, all of them are medically important, so we will give throw a light on every one of them. But for bacteria, dental caries, we already know what are the species involved for dental caries, including enamel and dentine caries, as we have studied in the previous slides. Then yesterday, gingivitis and periodontitis, the topic was finished. Periodontal disease, you already know, have studied the responsible pathogens, the pathogens responsible for causing periodontitis and periodontal diseases and the progression. And then pharyngitis and tonsillitis, you will also study in ENT, throat, ear, nose, throat. And that's why we will just be focusing on scarlet fever and tuberculosis. So bacterial infection, oral infection, we will focus on scarlet fever, tuberculosis, because they have specifically a very peculiar pathognomic hallmark features found in on the tongue. And then for fungal infections, as you know, oral thrush and candidiasis, oral candidiasis is the #1 most famous and important. So we will be just throwing light on studying only candidiasis for fungal infection. Other than that, angular stomatitis or angular cheilitis, we will also study that, or cheilitis, whatever you want to say. Histoplasmosis, phycomycosis, coccidioids, blastomycosis, and rhinosporidiosis. We will not study these in detail. So fungal infection, we will just be having a detailed discussion on candidiasis. Okay, yesterday we started viral infections. We have some viral infections: HSV, VZV, type A, Coxsackie, HPV, measles, EBV, and HIV. Yesterday we studied herpes simplex virus type 1, type 2. Type 1 was our favorite because it was more concerned with our oral herpes, commonly called as oral herpes. And then we had the most common viral infection affecting the mouth, type 1. Type 1 is more dominant towards oral side, and type 2 is towards the genital, causing the genital herpes. Other than that, then we studied the clinical transmission, oral or genital transmission, primaries and recurrent. And then there was primary HSV, varies widely in severity, either asymptomatic in 80% of case, but in 20% of case, the severity is much more and the clinical presentation is very severe, and they usually come to the hospital with a severe primary HSV, herpes simplex virus. And this was self-limiting to up to 10 to 14 days. There was single episode widespread stomatitis, and you remember coated tongue. HSV spares the oral cavity but coats the tongue. HSV coats the tongue, primary HSV. And then although generally self-limiting up to 10 to 14 days, it stays, but rare complications include herpetic encephalitis and meningitis. That's why we would like to give acyclovir in severely ill or immunocompromised patient, because if they get primary HSV, and then the complications are there. It's difficult to save life. It would be fatal. It will be, the mortality will increase. That's why we can give acyclovir in severely ill or immunocompromised patients. What are immunocompromised patients? Diabetics, increased LDL, obese patients, any comorbidities, any bad habits, smoking, chewing tobacco, AIDS, HIV patients, on chemotherapy, people on chemotherapy, right? So diagnosis was microscopically ballooning degeneration of epithelial cells with intranuclear viral inclusions. These are intranuclear viral inclusions, also known as internuclear bodies, inclusion bodies, intranuclear viral bodies. And then we also, for the systematic analgesia and topical, we can give some lidocaine oral gel. And then to prevent secondary infection, we used to give chlorhexidine mouthwash. The clinical features for this primary type 1 is important because it is usually asymptomatic, found in children, limited to 2 weeks, and it caused gingival stomatitis. Why we are studying primary HSV or HSV in this under oral infection? Because it caused gingival stomatitis or gingival stomatitis, usually in children, where there are vesicles and erosion and limited up to 2 weeks. Treatment acyclovir, this is the dosage, 3 times a day, 400. Then we studied recurrent, where the virus was dormant in one of the dorsal root and autonomic or cranial nerve ganglia, trigeminal particularly. And then when there is trauma, extreme happiness or extreme sad news, or immunocompromised situation, or less commonly to sunlight, stress, and febrile illness. What is febrile illness? Illness with the fever, when there is fever. Then that primary infection, which was hidden, will get reactivation. The reactivation phase will cause a recurrent HSV, recurrence of this disease. And then that disease will reoccur in the area of distribution supplied by the one branch of trigeminal nerve. And there will be a prodromal phase. Yesterday we know burning or tingling sensation before 24 hours, followed by vesiculation and pain. First there will be prodromal phase, burning and tingling. Then they will be followed by vesiculation and pain. How to treat these? 5% acyclovir. If it is immunocompromised or frequent recurrence, as we know, immunosuppression or immunocompromised patients have the incidence of these is one of the precipitating factors. So these people, if you know they are immunosuppressed, they have some comorbidity which cause immunocompromised state of the patient, then you know this, and then you know systemic acyclovir. We're trying to remember here as much as we can. Then the second one was varicella zoster. I told you this was a single virus, not 2 viruses. Single virus, 1 virus, but manifestation was different. In child, varicella infection, chickenpox is primary infection. Primary because the virus itself is responsible. But then is reactivation, because that virus was hidden, latent, and then it reactivated. So we have 2 infections by varicella, right? Varicella zoster, 2 infections. Children, primary infection, varicella infection caused chickenpox. Then it sleeps, it gets latent, it gets dormant in the dorsal root ganglion. And then when there is some febrile illness, when there is immunosuppression, when there is trauma, physical or emotional, then if it is hidden, latent, it will have opportunity to reactivate, and the reactivation phase is by zoster shingles, known as shingles. This will be shingles, single virus having two manifestations. So chickenpox, we know in children, itchy, vascular, cutaneous, and centripetal. Age 5 to 9. Rarely affecting the oral cavity, but it does. And then patients are contagious starting from the first 2 days before the rash until the, so you have first and second day, and then after 2 days we have rash, and up to the rash will, the vesicles will erupt, make superficial ulcers, and then there will be crusting on the ulcers up to the crusted lesions. From first day up to the crusted lesions, the child is contagious. That's why we don't send the child to the schools or the public areas or the parks when there is chickenpox. If you have suffered from chickenpox, you remember it was all over your back or your body, but it was good period because you had to have some break and you did not have to go to school. So that's why you remember it, because it was good time. But you suffered, that's also you remember you had chickenpox. And if you don't have, take care, because shingles can be there. Okay, and then to avoid shingles, what we can do? We have a vaccination, right? Yeah, this Zostavax is your best protection against shingles, recommended for adults 60 or over. People age 70 to 79 receive the vaccine for free if they did not had a incidence of chickenpox as a child. Then, so shingles, this was chickenpox, and now shingles, common in immunocompromised, alcoholic, and elderly patients. The symptoms were pain, burning, numbness, tingling, fever, headache, and fatigue. All the prodromal symptoms. Prodromal syndrome symptoms. And then shingles is a viral infection that causes a painful rash. Shingles is a viral infection that causes a painful rash. Shingles is caused by varicella zoster virus, the same virus that causes chickenpox, the same virus that causes chickenpox. Do not get confused during viva or any exam. Same virus causing two manifestation in two age group people. Common in immunocompromised, alcoholic, and elderly. Now we are talking about shingles. Is confined to the distribution of the nerve. Always present as unilateral lesion, never crossing the midline. Unilateral lesion. Facial or oral lesions may arise in the area supplied by the branches of trigeminal nerve. Diagnosis: there is pre-eruption pain. Before the vesicles erupt, there is pain. Can be abdominal pain, can be severe headache, can be a fever, but if you are talking about pain, it can be abdominal pain or lower abdominal pain, lower back pain, followed by development of painful vesicles on skin or oral mucosa. That's why we are studying, because there are sometimes painful vesicle on oral mucosa. That's why we are studying under oral infections. Also, skin wounds or wounds, whatever you want to say, in the distribution outlined above. So this is the distribution. The virus line inactivate in nerve tissue. The virus may reactivate as shingles and goes along the distribution of the nerve on the skin. Dermatome. You know what is dermatome? Dermatome is a nerve ending supplying or nerve supplying the skin, patch of the skin. C5, C6, C7, upper limb, right? L1, L2. Okay, varicella zoster virus, shingles, usually clear in 2 to 4 weeks. So it is usually clear in 1 month, after 1 month, with scarring and pigmentation, and can follow into severe post-herpetic neuralgia into up to 15% of the patients. That's why we need to give acyclovir within the 3 days of first vesicle. So first vesicle appeared, you see, okay, this guy does not have a chickenpox in as a child. Maybe it can be varicella zoster. You go for diagnosis, scrapping, PCR, and then you find the virus is varicella zoster, you give acyclovir within the 3 days of first vesicle, and then if he or she is the future patient of severe postherpetic neuralgia, you have saved him or her successfully. Good job. So again, this is a sign and symptoms, treatment, vaccination. So up to this, we have studied yesterday. And then we started Coxsackie virus, herpangina, type A. Coxsackie virus, herpangina, is a condition caused by Coxsackie A virus. It is confined to children. Usually, it's a condition found in children, right? How many we have here? 39 participants. Okay. And then clinical features: widespread small ulcers on oral mucosa with fever at general abscess. Same, but here we have on the fauces, on the palate, on the uvula. Tongue is not coated because tongue was taken care by the HSV. HSV said, I will coat the tongue. Herpangina said, okay, I will coat uvula, palate, and fauces. So coating, by coating means the ulcers or the vesicles or the lesions are found in the case of herpangina in fauces, palate, uvula. I have repeated it enough times. I hope you will not forget. This herpangina may be preceded by sore throat and conjunctivitis. So in some patients, some of them, they will come in and they have had a previous attack of sore throat, and then after 1 week or 2 weeks, they come in and show you this picture, this clinical picture. Oh, doctor, I have pain, and during swallowing, I have pain. Oh, during swallowing, you have pain, dysphagia. Oh, dinophagia. Oh, maybe esophageal cancer. Oh, come on. Open his mouth. Open the patient's mouth. See in problem. You are not dentist, but you can see the mouth, right? Okay. Not esophageal cancer. No. Okay, perfect. And then, yes, I have seen in some of my colleagues. Oh, dinophagia, you have pain during swallowing. So how long you have been doing this? Oh, 2 weeks. Oh, aggressive kinds of esophageal carcinoma. Come on. Because first go for the history and the common ones, right? Open his mouth, internal examination, tongue coated, maybe HSV. Take a scraping. Palate, uvula, fauces coated like this, lesions. Some of them have erupted, have ulcers. Okay, maybe herpangina. History of sore throat or conjunctivitis. He had 1 week ago, I had redness in my eyes, I had pain, infection, but it healed by itself. Okay, while conjunctivitis gone, maybe herpangina. Okay, perfect. Can also be mistaken as teething in children. So they are trying. You go to a doctor, pediatrician. He says maybe the child is in the stage of teeth eruption, teething. That's why he's crying. Oh no, open his mouth. Come on. Self-limiting in 10 to 14 days, same as previous virus. But this one spreads by fecal-oral route, so we need to take care. How to take care? Correct hand washing technique. How to prevent? Because it is fecal-oral route, so correct hand washing technique will help us to prevent, because there is no vaccine. So wash your hand properly. Let us wash our hands properly because there is no vaccine. So now you remember there is no vaccine for type A herpangina Coxsackie virus. And role of antibiotics, no role, because viral in origin. Antibiotics works against bacteria. How to treat it? We need to make things cool. Drink lots of cool foods, ice creams, cool diet, oral lozenges or lozenges. When you eat them, you look cool. So yeah, and fever makes you hot, cool it down. So you cool herpangina. Okay, you look cool and you make it cold because it's hot and painful. What are the symptoms of mouth ulcers by the herpangina? Painful blisters in the mouth, you know the common site, uvula, palate, and faucets. Headache, sudden high fever, treat the fever. There will be drooling and decrease in appetite. Why drooling? The salivary glands will try to cover those lesions which are painful by the help of saliva. And then you don't want to eat because, or the child does not want to eat because he has pain during eating. He says, okay, this process is too painful, leave it, I don't want to eat. He's crying, he's crying, he's crying. And some of our family members or someone else, the typical auntie from nearby will say, oh, this guy is erupting teeth, he is teething, that's why is crying. It's okay, no worries. Okay, and after that he opens the mouth, the mom opens the mouth, and he have some ulcers. Too late. The other disease was HMF, hand, foot, mouth disease, right? And then hand, foot, mouth disease is caused by Coxsackie virus, usually type A16, but less commonly by 5 and 10. So you have 5 fingers in one hand, 10 fingers in both hands, and foot, 5 fingers in one foot, both feet, 10 fingers. So 5 and 10. Yeah. Is similar to herpangina, but the lesions are present throughout the oral cavity. A papular vesicular rash appears on the hands and feet. So no, it not only be vesicular, but papulo-vesicular rash will be hand involved, feet involved, mouth involved. In conjunction with nasal congestion and oral mucosal vesicles. These break down. What these rash lesions will break down, leaving painful superficial ulcers, particularly on the palate. We also had ulcers, lesions of the palate by Coxsackie A virus. Not difficult to remember. Coxsackie A loves palate, uvula. The gingiva are rarely involved. It is self-limiting again to like 10 to 14 days, up to 2 weeks. Treatment, same as herpetic stomatitis. What is herpetic stomatitis? Anyone? Answer, please. Herpetic stomatitis. We have studied here. Herpetic is herpes. And then stomatitis is this one. Remember this diagram? Gingival stomatitis caused by primary HSV, type 1, herpetic stomatitis. Different names. I have not written here in brackets so that you can remember it by different names. Herpetic stomatitis, gingival stomatitis, found in children, self-limiting. Okay, this is another presentation of hand, foot, mouth disease, common viral infection, usually the age under 10, characterized by fluid-filled, means vesicular, blisters, and they appear on hand, feet, and inside the mouth. Spread by direct contact with the nasal discharge, saliva, feces, and fluid from the rashes on the infected person. Signs and symptoms: fever will be there, sore throat will be there, ulcers in the throat, mouth, and tongue, lesions on the hand, rash with vesicles, small blisters 3 to 7 millimeter on hands, wrist, feet, and diaper area. So these are the flexor surfaces. The hand flexes on the forearm at wrist. And diaper area, we have the flexor area for the lower limb to the attachment of the abdomen, right? And then there will be headache. That the vesicles are typically on the palm side of the hands and sole of the feet. So palm and soles are not spared. Palms and soles are the area where these vesicles are present. Palms and soles are not spared in hand, foot, mouth disease of Coxsackie virus, which is by type 16, typically type A16, but sometimes 5 and 10, because 5 and 10 we have 5 fingers in one hand and 10 fingers in two hands. So that's how you remember. Complications: This is usually a mild illness with the rash healing in 5 to 10 days, 5 to 7 days, 10 to 7 days. Okay, completely disappears. Cases can worsen when it involves the nervous system and heart. We will not let the cases to get severe, complicated, because we can diagnose this. We know somehow. Treatment, there is no specific treatment. So prevention, there is no treatment, then we have to prevent it. How to prevent? Consistent hand washing particles, because fecal-oral route, with clean water and soap before preparing food, after going to toilet, after changing diapers. You know why? Because to us, it's the person who is feeding the child has to wash hand properly before preparing food and giving food, or going to toilet, or after coming out of toilet, before coming out of toilet, and then use clean water and soap to clean your hands. To cover mouth and nose when coughing and sneezing, because it travels from saliva and sneezing, remember? Yes, nasal discharge and saliva and feces. So you need to cover your mouth and nose while coughing and sneezing in the presence of children or another mother or a father. Discouraging the sharing of clothes, towels, eating and drinking utensils, and stuffed toys. To clean toys, chairs, and tables if contaminated by children. So now you know a person had hand, foot, mouth disease, not coming to school. Then if he has visited your home for playing with your child, and some children had some daycare center, they are playing. Okay, you need to stop that. If you know some things are associated with that child, the toys, the chairs, the tables, the utensils, clean them, boil them properly. Children should be kept away from crowded places, public places such as schools, preschools, playgroups, and markets and public transports if they show signs of infection. Thank you for the picture. Okay, now we go, before going to 3 viruses, we go to a quick visit of people here. Okay, so if you have any question related to these, you can ask.